ఇప్పుడు మనతో ఉన్నారని ఎస్థెటిక్ కన్సల్టెంట్ డాక్టర్ మిలీ సిన్హా. సో యాంటీ ఏజింగ్ గురించి బోల్డ్ అన్ని డౌట్స్ అడిగేద్దాం డాక్టర్ని. అసలు ఏ ఏజ్ నుంచి స్టార్ట్ అవుతుంది, ఏ ఏజ్ వాళ్ళకి ట్రీట్మెంట్ ఇస్తారు, ఇక అదే విధంగా ట్రీట్మెంట్కి ముందు ఎలా ఉండాలి, ట్రీట్మెంట్ తర్వాత మెయింటెనెన్స్ ఎలా ఉండాలి, ఇలాంటి బోల్డ్ అన్ని క్వశ్చన్స్కి డాక్టర్ గారు సమాధానం చెప్తారు. హాయ్ అండి.
హాయ్,
హౌ ఆర్ యూ?
ఐఎమ్ వెరీ వెల్, హౌ ఆర్ యూ?
యా ఫైన్. సో మిలీ, యాంటీ ఏజింగ్ సబ్జెక్ట్ ఓకేనా? సో ఏ ఏజ్ వాళ్ళు ట్రీట్మెంట్ తీసుకోవచ్చు యాంటీ ఏజింగ్ ట్రీట్మెంట్?
See, anti-aging typically you should start once you're, in your late 20s. So after the age of 27, 28 is when you can start using skincare products that help you with anti-aging and also prevention. Okay, and when it comes to aesthetic treatments, right, post 30 is the right age to start off with anti-aging treatments in a clinic.
ఏజ్ 30 టు స్టార్ట్ అంటే ఎండింగ్ ఏజ్ 60 or 70?
Oh, so there is no ending to, until when you want to take anti-aging treatments, like, because aging is a continuous and a natural process, right? So if we want to prevent aging signs, we want to maintain our skin at a certain age level, then we need to keep doing some maintenance treatments till the time we want to do it.
ఆఫ్టర్ ట్రీట్మెంట్ precautions.
Whenever you get any anti-aging treatment done, so depending on the treatment that we're doing, like if you're doing Botox, we're doing fillers, thread lifts, or any energy-based devices, then every treatment has its own precautions. Like, you have to ensure that you protect your skin from the sun. You ensure that you keep your skin much hydrated and moisturized. Also use some supplemental oral intake that you do for that products that can help you with anti-aging.
యాంటీ ఏజింగ్ ట్రీట్మెంట్ టైమింగ్ అంటే లైక్ రింకిల్స్ అనుకోండి.
So, so whenever we're talking about anti-aging treatment, so we can divide them into two segments, right? One is the corrective therapies and the other are preventive therapies, right? So when I say corrective therapies, that is when you already have those aging signs and we want to remove them or we want to reduce them. When we come to preventive treatments are that you start at a little earlier age and you prevent those signs from coming, right? So under corrective treatments, we have Botox, we have dermal fillers, we have thread lifts, then we also have some microneedling treatments that can be done to correct. Preventive treatments are treatments like nowadays we have a lot of skin boosters, we have exosome therapies, we have GFCs, we have mesotherapy, we also have energy-based devices that can help in improving the signs plus as well as also reducing the signs over a long period of time. So depending on the treatment, the duration of the treatment will last. So like say if you're talking about a botulinum toxin injection, that is a lunchtime procedure. You can just come, get it done in 15-20 minutes and you're off to your daily routine activities. Similarly, if you're talking about dermal fillers, depending on where we are injecting, what amount of fillers we are injecting, the treatment also would, the duration of the treatment would be anywhere between say half an hour to 1 hour. That's about it. Thread lifts might also take a similar time. When we're doing so any procedure that we are doing will not be for anywhere longer than 1 to 1.5 hours.
Okay.
That's about it.
సో సిట్టింగ్స్ ఎన్ని సిట్టింగ్స్ తీసుకోవాలి?
Yeah, so there are single sitting treatments. There are treatments that you have to take multiple sessions. Typically, injectables, they are mostly single sitting treatments that are repeated after a certain interval of time.
Okay.
Like Botox is done every 3 to 4 months time it is to be repeated. Dermal fillers are repeated anywhere between 1 to 1.5 years. Thread lifts are repeated every 6 months. Microneedling usually needs to be done repetitive sessions for the initial few months and then you can do maintenance. Energy-based devices like HIFU, therapy, Thermage, they are done typically once a year or once every 6 months.
ఓకే. సైడ్ ఎఫెక్ట్స్ ఏమైనా ఉంటాయా?
See, generally there are no long-term side effects. Only immediate side effects can be there, where you may have a little bit of redness or swelling on the
Okay.
skin, which will last you for a couple of hours,
Hmm.
maybe up to 24 hours. There can be pain at the injection site if it's an injectable procedure. That also
Okay.
is short term.
Hmm.
As such, no long-term side effects. Yeah, so injection, definitely, it's an injection. You will have some amount of discomfort, but it is
Okay.
usually very less and minimal. Plus, we also generally use a topical anesthetic
Yes.
before we do the procedure. So it's fairly comfortable.
20-25 ఓకేనా. సో స్కిన్ కేర్ వాళ్ళు ఎలా తీసుకోవాలి?
So see, whenever you are in your 20s, right?
Yes.
So that is the time when we want to enjoy life and all that. But coming to skincare, if you are taking good care of your skin in terms that sun protection, proper hydration, proper cleansing, in those terms, if you take good care of your skin in your 20s, then definitely your aging signs can be fairly less when you're approaching 30 and plus age, right? So you must always have a good skincare routine which is suitable to your skin type. You should be regular in terms of that. You should have a healthy lifestyle, healthy food intake. Also, you must ensure that your nourishment level is optimum. Avoid things like high glycemic foods.
Yes.
Avoid alcohol, smoking, because these all are going to impact on the aging signs, right? So we must do everything in moderation and try to limit going overboard with a lot of things like alcohol, smoking, junk food.
సో స్లీప్ డిస్టర్బెన్స్ అంటే స్లీప్ ఎఫెక్ట్ కూడా ఉంటుందా?
Yes, definitely. Sleep also. See, our body has a circadian rhythm. That means what? That depending on the time of the day, there are certain hormones that are released into the body which direct our body towards a specific thing that we have to do. Like when we are during the night, there's secretion of melatonin. Now, melatonin helps in having a proper sleep cycle. Now, suppose your sleep cycle is disturbed. Even though there is melatonin secretion and you don't sleep, that's going to impact your skin. Why? Because nighttime is meant to be repair of the skin or the entire body system. Now, if we are not sleeping, the secretion of the hormones is not taking place, right? So the repair is not going place. So when you get up in the morning, you may feel your skin is very dull, looking tired and dehydrated. So this happens. So that is why it's very important to have a very good skincare routine. Not just that, but also a proper lifestyle management.
సూపర్. సో అంటే మొబైల్స్ ఎఫెక్ట్ ఎలా ఉంటుంది?
Okay. Mobiles, yes. So couple of problems that we can face with mobiles, especially when you have a long hours of usage, right? So first is you can on your skin, because it's a screen, right?
Yes.
It is also emitting light. That light can cause damage to the skin. One, right? Second, you're also, when you're watching the screen, you're straining your eyes when you're doing it continuously over a few hours. Third, then you're also, the posture of your body, that is changed, because you're
Yes.
always bending down, or keeping your spine in a specific angle to view the screen. So that again disturbs your postures, and then you can have early pains and aches in the body, right? So these are the a few side effects that I can tell you.
Yes. సో ఇప్పుడు మనం ఫేస్కి సంబంధించి బ్యూటీ గురించి, స్కిన్ కేర్ గురించి మాట్లాడుకుంటే ఫేస్ వాష్ బెటరా, సోప్ బెటరా?
Definitely a face wash is better, because it is meant for cleansing your face. The pH of the product is much similar to the skin pH. Soaps have more harsher chemicals as compared to face washes. Plus, face washes are combined with certain ingredients that can help different skin types in different solving different issues.
ఓకే. సో బాడీకి కూడా బాడీ వాష్ బెటరా, సోప్ బెటరా? అంటే టోటల్ బాడీ బ్యూటీ అంటే
See, even soaps now, there are soaps called scented bars that can be used to use as a body wash. So you can use a body wash, you can use a scented bar. Either is okay to use, not an issue.
వెరీ గుడ్, సూపర్. ఫైనల్లీ మన స్కిన్ని మనం చాలా బ్యూటీగా చూపించాలి అంటే స్కిన్ కేర్లో రొటీన్ ఏది అంటే ఏం చెప్తారు?
See, whenever I am suggesting somebody a skincare routine, I say 3 most important things that you should do is cleansing, moisturizing, and sun protection.
Yes.
These are the most integral part of any skincare routine. Having said that, if you have skin issues, you could be having pigmentation, acne, aging signs, dry skin. If you have these conditions, then you should also add products that are helping you combat these issues. So for anti-aging, you can use products that are based on retinol based products. For acne, you can use products that have salicylic acid or benzoyl peroxide. For dry skin, use products that have ceramides and hyaluronic acid. Pigmentation, you can use products that have glycolic acid, kojic acid, arbutin, etc. Right? So definitely keep a basic skincare routine which has a cleanser suitable for your skin type.
Yes.
Always use a moisturizer whether you have oily skin or not.
Okay.
Or like for all skin types, moisturization is important, and sun protection without any doubt. You have to use a sun protection. Plus add on a product that is suitable for your skin issue.
Because for oily skin ante separate, for dry skin separate,
Right.
depend on the skin type maybe.
Yes.
So that's my question.
Okay, so depending on different skin types, there are different sunscreens and moisturizers available. So if you have oily skin, then you must use products that are thin in their consistency. They are more water based. Okay, they are not as creamy as thick. Right? If you have dry skin, then use products that are more thicker, which give you some hydration level, which also put a barrier on your skin and reduce the water loss from the epidermis. So these are the different types of products that you can use. More water based and thin consistency for oily skin, thick based products, lotions and creams for dry skin.
Every day how many times అంటే ఎన్ని సార్లు ఈ మాయిశ్చరైజర్ అప్లై చేయాలి?
Moisturizer depending on your skin's need. Right? So whenever we are recommending any skincare routine, so nighttime application of moisturizer is a must.
Okay.
You must apply because that is the time when the skin is resting and also repairing itself. So a moisturizer will help in that. Apart from that, if a person has drier skin type, then they must use it during the day also. So say once or twice daily is good enough.
సో మిలి గారు యాంటీ ఏజింగ్ ట్రీట్మెంట్లో బొటాక్స్ అనేది ఒక హెల్ప్ చేస్తుంది. సో అంటే ఎలా ఉంటుంది ఈ ట్రీట్మెంట్ ఫస్ట్?
So basically, Botox is a type of a toxin which, when injected, it binds to the muscle receptors that are present on the muscle, and it helps the muscle not contract. So whenever we are making an expression, like when we are smiling, when we are frowning, or we are raising our eyebrows, then there are certain lines that appear, right? So what the Botox does is it goes and binds to those receptors and prevents that muscle action. So once that it's injected into the muscle, whenever we make an expression, those lines will not be visible, right?
Yes.
So like when you're smiling, right, there are a lot of lines that come here. When we do Botox, you'll still be able to smile. You will have a natural expression, just the lines won't be visible. So this is where the Botox comes into picture. Right?
Okay.
Typically, a Botox treatment, it's the most simplest treatment that one can get done. It has a quick result, and it lasts you anywhere between 3 to 4 months.
Okay, 3 to 4 months.
So typically, twice every year, you can do a Botox treatment, and you can maintain your skin.
Okay, time treatment ki ఎంత టైం పడుతుంది?
Treatment, like I said, it's a lunchtime procedure.
Okay.
Right? So you have a lunch break, you come to the clinic, get the procedure done, and you can go back, do your normal daily activities. Okay. There is no downtime, there is no side effect as such, and your normal daily activities will not be disrupted when you do a Botox. Mildly uncomfortable. We apply a numbing cream before we do the procedure, so it becomes fairly easy.
ఎన్ని సైడ్ ఎఫెక్ట్స్ ఉంటాయి అంటే బికాస్ ఐస్ కి దగ్గర కాబట్టి ఏమైనా సైడ్ ఎఫెక్ట్స్ ఉంటాయి?
It is done, you always must get the procedure done from a person who's well trained and experienced in doing it. That's the important thing. So if somebody knows how to do it, the chances of any side effects are next to zero.
Yeah.
Okay, the only thing that can happen is you may have a injection site pain for a few hours. At the site of injection, there's a small mosquito bite like swelling that goes away in half an hour's time. And that's about it. To see the results of the treatment, it takes around 7 to 10 days, where you will slowly and gradually see that the lines are slowly not coming whenever you make an expression.
సో అండి అంటే ఎప్పుడైనా సరే మనం ఏదైనా ఒక మంచి ట్రీట్మెంట్ తీసుకోవాలంటే సర్టిఫైడ్ డాక్టర్స్ దగ్గరికి వెళ్ళాలి అని చెప్తున్నారు. ఎవరితో పడితే వాళ్ళతో చేయించుకుంటే ఖచ్చితంగా సైడ్ ఎఫెక్ట్స్ అయితే ఉంటాయి, దాంట్లో నో డౌట్. సో నెక్స్ట్ డర్మల్ ఫిల్లర్స్ అనేది చేయించుకోవాలి అంటే మీ దగ్గరికి ఎప్పుడు రావాలి?
So dermal fillers are done for multiple reasons. So they are done for skin contouring. They are done for enhancing your one's features. They are done to repair certain defects in the eye, on the face. So like if you have very thin lips, if you do a dermal filler, you can reshape the lips, you can give them volume, you can make them look more plumpy and hydrated. Okay, it's not a permanent treatment. Once you do it, it will last you for around say one to 1.5 years, and later on if you want to repeat it, you repeat it. Okay. Similarly, if somebody has a very deep set eyes or dark circles or under eye hollow, we can do a dermal filler and that defect can be corrected, so you look much more fresh and you look more happier, right? Think people who have sagging skin, they have their chin is smaller, there can be nose reshaping that can be done. Some people also have hollowness on their temples. All these defects can be treated with dermal fillers. Dermal fillers, depending on the type of the place that we have to inject, the type of filler is decided depending on softer filler or something that's more harder, which will, like on the chin, we do slightly harder fillers which have a higher G prime, so that it gives a proper shape to the chin. So these are dermal fillers. The result that you see, it's instant. Once we do the injection, the result is visible immediately, and the result will last you for maximum up to a year to 1.5 years.
Okay. Treatment timing?
It depends on the number of injections we are using, because it comes in syringes, right? So how many ml we are injecting? So half an hour to 1 hour is the duration of the treatment.
So sittings ante any sittings something?
In this, usually sittings are not there. Why? Because suppose I want to do a lip filler, so I do it once, right? Once it is done, you are good to go. And if you want to repeat it, then you come whenever you want to repeat it. So it's a single session treatment.
So next, skin tightening. Andarki chala interesting subject kabatti skin tightening ane treatment ela untundi, ఏ టైంలో మీ దగ్గరికి రావాలి?
Okay, so skin tightening procedures are one of the best anti-aging procedures one could do, because they not just do corrective treatment, they also do preventive management, right? So multiple treatments like radio frequency devices like Forma, Thermage, there is HIFU, there is UL therapy, there are also treatments like microneedling. These treatments are done to improve your skin visibility and also lift your skin, right? So the fine lines improve. If there are folds on the skin, they improve. There is a little bit of lifting of the cheeks that happens. If you have, people have jowls, which are, skin folds that appear just next to the chin area. So we can improve that. So these treatments, they are mostly non-invasive treatments. There are also invasive treatments available, but non-invasive treatments are fairly good. They're not as painful. Most of the treatments can be done in one sitting only, and they give you a result that can last you up to a year.
Aging prevention treatment.
Aging prevention treatments are treatments that are done so that the signs of aging are not as prominent. Right? So the lines are less visible, sagging does not happen, and skin looks more hydrated and plump. Treatments under this category would be skin boosters, which are hyaluronic acid injections, which are once injected into the skin, they make your skin look more fresh and younger. Then there are treatments like exosomes, which are stem cell therapies and their growth factors that are injected on the skin, and they do collagen remodeling. Then there are treatments like microneedling. Example would be Morpheus, that can help in fine lines, acne scars, skin tightening. These treatments are preventive treatments. So if you keep doing it on a regular basis, the visible signs of aging will not be as apparent and the aging process will slow down.
సో ట్రీట్మెంట్ అంతా అయిపోయిన తర్వాత దాన్ని మెయింటైన్ చేసుకోవడం చాలా ఇంపార్టెంట్.
Yes, definitely. Maintenance is very important. So once you've kind of achieved your anti-aging goal, you want to maintain it, you must on a regular basis, depending on what you're comfortable with, what discussion you have with your doctor, you should do certain maintenance treatments. Maintenance treatments would include GFC, mesotherapies, skin boosters. These are few treatments that you can do as maintenance at a regular interval, so that whatever result you've achieved stays for a longer period of time.
సూపర్. సో చూశారు కదండి, మిలి గారు ట్రీట్మెంట్స్ గురించి చాలా బాగా ఎక్స్ప్లెయిన్ చేశారు. ఎవరైనా సరే అండి ఇంట్రెస్ట్గా ఉంటే మాత్రం కింద స్క్రోల్ అవుతున్న నెంబర్కి కాంటాక్ట్ అవ్వండి. ఇక్కడ ట్రీట్మెంట్ తీసుకోండి. లా క్లినిక్లో బెస్ట్ ట్రీట్మెంట్ ఉంటుంది. ఎవరు మిస్ అవ్వకండి. థ్యాంక్ యూ సో మచ్.
Thank you.